going to be joined by Helen-Louise Usher. Helen-Louise is the Manager for Clinical and Support Partnerships at Children's Health Queensland, and she's going to be talking with us about a piece of work that we've done in conjunction with the Starlight Children's Foundation. Helen-Louise.
Are you going to give me a wind-up? Do you give me a warning?
I will give you a warning.
Because I could talk for hours, remember. Thank you very much. Hi everybody, I'm lucky last for today and it's fantastic to have you all here. Firstly, I'd like to acknowledge the traditional custodians on the land on which we meet today. I pay my respects to elders past, present and emerging. I'd also like to give a shout out to Beck Parker from the Starlight Foundation, who's here today, and she's here to give me a bit of cheer on and answer any tricky questions that you might have for Starlight after the presentation. This is really a joint presentation between Children's Health Queensland and Starlight. I will be presenting it from my point of view, but I've certainly got lots of anecdotes and feedback from other people that have experienced this initiative and also from discussions that we've had about the success so far. So first of all, I'd just like to give you a little bit of context about who I am and where I'm from. And I might see if I can move the slides as well. Is there a trick to this? The mouse. No, not the mouse. The clicker. Okay. No.
The other way.
Oh my goodness. Okay, do we have a bit of a tricky clicker? We do. Okay, very sensitive clicker. Thank you. Non-sensitive. Okay, so I'm extremely fortunate to work for Children's Health Queensland, and you've probably heard quite a few presentations from my colleagues today. I'm the manager of the partnerships, and I'm based at the Queensland Children's Hospital. And Dan had a beautiful photo of the hospital up earlier. At the hospital, we look after some of the sickest children in the state and from across the country. And we can't do this work all on our own. We value and build strong partnerships with our business partners and our non-government organisations. We also have clearly articulated values: imagination, care, integrity, respect. It's great to recognise the imagination values that we have. It encourages us to develop a what if and what next into our everyday thinking. Going to be tricky. Okay. Over the past 2 years, our organisation has looked at all our clinical services and had conversations with key stakeholders, consumers and our NGO partners about the future of healthcare. We've released the Children's Health and Wellbeing Services Plan and the Aboriginal and Torres Strait Islander Health and Wellbeing Services Plan. These plans represent CHQ's blueprint for meeting the changing needs of our children and young people over the next 5 to 10 years. They demonstrate a commitment to integrating care based on current health data in conjunction with the social determinants of health. These documents are available online on our website, and we have hard copies at our trade desk in the foyer if you'd like to come and have a look at them and take a copy. We also have a community collaborative. In early 2018, we formed the CHQ Community Collaborative. We did this by inviting our NGO partners to meet with us on a quarterly basis at executive and chief executive level to start conversations about how we can work together to improve the lives of children and young people of Queensland. And Starlight Children's Foundation is a member of this collaborative and have been a strong partner with us since we opened our doors at QCH 5 years ago. So Starlight built the Starlight Express Room at QCH, and they provide Captain Starlights and Livewire programs for our adolescents 7 days a week. So at the same time that we were opening our hospital doors, Starlight was also starting a Healthier Futures initiative in WA and the Northern Territory. So what they started to do was send their Captain Starlights out on the ear bus as a population health approach to improve ear health in Indigenous communities. So what is it exactly? Well, it's a partnership model to support rural and remote communities' access to health services. but it's working alongside the clinicians as part of the team. What they've found is that they've seen a 30% increase in attendance at the clinics. They've had a decrease in fail to stay. Sometimes these clinics are long days or days, and people are expected to come back every day. And what they've seen is that people are happier to stay, children and young people are less stressed, parents are less stressed and happier to stay, and that makes the health professionals' job a lot easier, and they have increased throughput and better outcomes. Oh my goodness. Okay, so the first Healthier Futures visit that we did was in March this year. We had a little bit of anxiety from our team at CHQ about taking Captain Starlights out on a visit with them. It took quite a bit of talking to convince them to give it a try. They were concerned about it being a little bit more work and a bit more stress for their health professionals, and in an already busy clinic, they weren't really sure if they could cope with that. But they said, okay, we'll give it a try. We had a 4-day clinic. The captains drove out on day 2 and they stayed for day 3, and then they went home at the beginning of day 4. And what this actually did was gave the clinicians a really nice contrast between them not being there and them being there. And they were absolutely amazed with the difference that they saw. So a couple of weeks later, they were invited again. I'm really struggling with the mouse, sorry guys. Do you think the battery's nearly gone? Can I use the mouse? Just the clicker? Do we have a keyboard? Yes, we do. Okay. So, the opportunity. We started Healthier Futures with Deadly Ears, and about 3 or 4 weeks after the first trip, I got a call on my mobile from Jo Dan from Starlight, and she was very excited. She caught me going into a meeting and she just wanted to tell me that there was some grant money coming. They'd received some funding, it was quite a good amount, and it was to help them expand Healthier Futures into Queensland and South Australia. And what could we do about it? We need to hit the ground running, we need to get going pretty quickly, and we need to spend the money fairly, within 12 months. So we need to look at, she also said we need to partner with other health organisations, and could I give her a hand? How could we do this? So we looked at an expansion process. So we had discussions with our chief executive, who's right here, our executive directors, clinicians at the Queensland Children's Hospital, discussions with the Northern Children's Health Collaborative, which is a fairly new collaborative. They have a project manager who could link us into all the Northern HHSs. We leveraged existing networks across the state to provide support and gather momentum. And within a couple of weeks of talking to people, Starlight began booking their trips with multiple clinical teams across the state. They're now going out with Deadly Ears, some of the cardiac teams, and the rehab teams. We're also having conversations with Cairns HHS at the moment about where they can go with those teams as well. So here we have some data about where we were looking at going and where we've actually come to. So the number of Captain Starlight visits that they were planning to make within 12 months was 50. The total current at the moment that we have booked is 44, and there's 34 of those booked in Queensland. So we've got until May next year, so we've still got a way to go yet. We were aiming for 50 Captain Starlight visits to hospitals, health centres and clinics across Queensland and South Australia. So we've got 62 already booked in. Starlight was aiming to have 500 children participating across Queensland and South Australia in the next 12 months, and they've already hit 1,500. The projected number of children participating by May 2020 will be more than 3,000 children. So they're really, really thrilled with the results, and everybody's really happy with the outcomes that they're seeing at the clinics. The health professionals are enjoying the experience, the children are happier, they're finding that the clinics are calmer, there's less anxiety, parents are less stressed, and then parents and children are more likely to stay and more likely to come back. So here's a quote from one of our Deadly Ears allied health team members. So Starlight captains will do magic tricks, chat, read a book, they'll sing, they'll dance, they'll do whatever they need to do at the time. They're led by the clinicians. They can dial it up if they need a bit of noise and excitement, and they can dial it down if they need really quiet, calm play and in an environment when there's hearing testing going on or there's operations happening. But they're really good at just reading the room and doing what needs to be done. So here's another article from Thursday Island. Sorry, it's a little bit blurry, but basically they're really successful with their visit up there. Here's a letter from the trachoma screening. What a great team. They were brilliant with the kids. And when they left, the community asked me where they were. They were missed. I'll just let you have a read of that one. Everybody's asking for more, which has been really fantastic. So what are the ingredients for success? We have a strong partnership model. We trust Starlight. We've worked with them for a long time and we know that we can rely on them. And some of that trust flows through in our discussions with other health services. We trust Starlight, so they'll trust Starlight as well. We talk about the experiences that we've had and where we can take this. Starlight will always provide a service that's based on a clinical need. They don't want to go where they're not wanted, and they don't want to provide something that's not needed. And I think that's why it's been so successful. The captains will take their lead from the clinical teams, and Starlight is really happy to trial different models of care. So, for example, one of the things that we're looking at doing next year in March or April is providing a third birthday party in Cherbourg. So this is an idea that's come up from the Health Advisory Group at Cherbourg, and in discussion with the Child Health Services up there, they'd like to give this a try. So they asked Starlight, can you come along and give us a hand? So Joe and I drove up to Cherbourg and had a meeting with the Health Advisory Group and talked it through. Joe's been back a couple of times to talk further with them. And what they're going to do is invite all the children that turn 3 next year to this party to do their developmental health checks, their height, weight and measures, and just do some assessments with the children. So they're looking at 50 to 70 children coming down for the party. So Starlight's actually really excited about this, and we're really happy to give this a try as well. So if you'd like more information about Healthier Futures, if you think that Starlight could partner with you and help you, please contact Jo Dan and have a chat with her. They do work Australia-wide and they're always interested in looking at where they can provide more support. If you'd like to talk to me further about Healthier Futures or other partnership questions that you might have, I'm very happy for you to contact me as well. And that's it. Am I under time?
Done.
Thank you.
Are there any questions for Helen-Louise about this initiative in particular?
No.
I'll just make a comment,
Okay.
if I may. I just wanted to really reflect to the group here about the importance of thinking laterally and using your imagination around engagement of children and families. So integrated care isn't simply about education, health, justice. It's about integration with community. It's about integration with families. It's about integration with our NGO partners who deliver a whole range of different approaches and different services that support capacity building, health literacy, and direct clinical care in communities. So we have found with up to, at Children's Health Queensland, with up to 50 NGO partner organisations, that the possibilities are endless. So for your hospital and health services or for your departments, when you're thinking about integrated care, think broadly, think laterally, use your imagination, and fail fast. So if you're going to develop something, test it quickly. If it doesn't work, move on and move on to the next thing really quickly. But I just wanted to thank you, Helen-Louise, and to our colleagues at the Starlight Foundation we have a very deep and a very respectful relationship, and outcomes for these children across the northern part of our state has been outstanding. So thank you all so much. Thank you, Helen-Louise. Through my excellent chairing, what I've been able to do is get you almost 30 minutes or 20 minutes back in your day. But I just wanted to reflect for a moment before you leave for today on the sessions that you've heard. I think as we've journeyed through each of the sessions, what we've heard is the importance of trust, the importance of interpersonal relationships, and the importance of giving things a go. And one of the things that I've learned about coming to Australia and to Queensland in particular is that, heavens, we're good at giving things a go. And if we're to think about the future of integrated care, I mentioned in an earlier session that we should be thinking about this as a journey towards excellence. And like any journey towards excellence, there is never an end in sight, because as outcomes improve, there are more demands. There are more demands in the social determinants. There are more demands in the system. So we have to keep moving with it, and we have to keep moving at pace. Finally, I wanted to say, enjoy the networking event this evening. If you get an opportunity to go down to the boat shed or down to the promenade, there are a series of social gatherings down there. Lots of fantastic conversations have been started today. Some have finished already, but I think there are lots more to come. So thank you so much for attending this session. Thank you for attending this conference. And thank you for making those connections with your colleagues that hopefully will be enduring, so we can see more presentations like this at the next Integrated Care Conference. Thank you and have a lovely evening.